Hey everyone, welcome back to The Explainer. Look, if you've recently been told you need gum surgery, or maybe you're stuck in this endless, frustrating loop of deep cleanings every 3 months, or worse, you've been told your teeth probably can't be saved, take a deep breath. You are in exactly the right place. Today, we're breaking down the LANAP Decision Guide. It's a really comprehensive resource designed to completely demystify your options and, most importantly, put you back in the driver's seat of your own dental health. Okay, let's dive into this. The source document gives us this incredibly powerful and frankly super hopeful takeaway right off the bat. It says most gum disease can be controlled. Many teeth that have been written off can be kept. There are now multiple credible paths. LANAP is one of those paths. Man, if you're feeling anxious about a diagnosis, finding this line in the guide is just a massive breath of fresh air, isn't it? It offers real hope. Our whole goal with this explainer is to give you the knowledge to understand these paths with absolutely zero pressure. So here's our roadmap for today. We'll be hitting 1. The reality of gum disease. 2. When deep cleanings stop working. 3. Traditional surgery versus LANAP. 4. The true cost of treatment. We're talking real numbers here. And 5. Taking control of your care. All right, kicking things off with Section 1, the reality of gum disease. To actually fix a problem, we first have to understand its quiet, sneaky nature. See, healthy gums hug your teeth really tightly, almost like a turtleneck. But when bacteria collect and your immune system fights back, you get inflammation. Over time, your bone literally retreats to get away from the infection. Once that happens, the gum stops hugging the tooth and it creates a pocket. And here's the kicker. At 4 to 5 millimeters deep, your toothbrush simply cannot reach the bottom. You literally can't brush this away because those deeper pockets become a safe haven for aggressive, oxygen-hating bacteria. They're basically these angry, microscopic introverts that just feed on the inflammation. And that brings us to a fundamental rule from the guide. Bone matters way more than gum. Gum tissue, it can swell, it can shrink, it can migrate around. But bone, once it's gone, it doesn't just grow back on its own. No way. So the absolute ultimate goal of any treatment you consider moving forward has to be about protecting the bone you still have left and giving it the best possible chance to rebuild. Now, what's really interesting about this next slide is Section 2. When deep cleanings stop working. Scaling and root planing, which is what we typically call a deep cleaning, is a really great tool for early pockets. But the guide is super clear about this. There is a strict mechanical sealing. Past 5 or 6 millimeters, those hand scaling instruments your hygienist uses just cannot reach the bottom reliably. It's a physical limitation. The tartar and the inflamed tissue down at the very deepest point get missed, and those bacteria, they just repopulate within weeks. The guide makes a point to really validate this for you. If your pockets aren't shrinking, it is not a flaw in your brushing or flossing. It's literally just a limitation of the tool itself. So what do you look out for? Well, the guide outlines a very clear warning sign. After 2 rounds of proper deep cleanings, your pockets should measurably shrink. If your numbers are flat, or worse, if they're growing, and the office is just scheduling you to come back every 3 months indefinitely, that's the signal right there. It is time to look at definitive alternative options. Which leads us perfectly into Section 3, traditional surgery versus LANAP. For nearly 50 years, when cleanings stopped working, the standard has been osseous flap surgery. Let's compare that to LANAP, which stands for Laser-Assisted New Attachment Procedure. Instead of physically cutting the gum and peeling it back like traditional surgery does, this treatment uses a very specific wavelength of laser light that's just passed between the tooth and the gum. It selectively destroys the diseased tissue, but, and this is the cool part, it leaves the healthy tissue, the tooth structure, and the bone completely intact. The massive appeal here is pretty obvious, right? You completely avoid that whole cut and stitch approach. But why this specific laser? Why not any laser? Well, the guide builds some serious credibility here. It notes, the PerioLace MVP7 laser used in LANAP is the only dental laser cleared by the FDA for true periodontal regeneration. Listen, that isn't just flashy marketing language. That FDA clearance means there is actual, hard clinical evidence supporting the claim that it creates a scaffold for your body's own cells to reform attachments. And this brilliantly illustrates the real-world trade-offs, because the differences are honestly stark. Traditional flap surgery physically cuts the gum, it often actually removes bone by design, requires stitches, and means you're looking at 2 to 4 weeks of recovery eating mushy soft foods. Plus, it carries a moderate to high risk of permanent gum recession, meaning your teeth end up looking a lot longer. LANAP, on the flip side, no cutting, no stitches, a low recession risk, and most people get back to their normal routine in just 24 to 48 hours. So what does the actual day of experience look like? Let's demystify it step by step so you know exactly what to expect. First, a LANAP visit typically just requires standard local anesthesia. Next, a laser fiber, which is roughly the width of 3 human hairs, it's tiny, gently destroys the diseased lining of the pocket. Then ultrasonic instruments are used to clear away the tartar. After that, the laser is used a second time, but on a different setting, to create a stable, sticky blood clot that seals the pocket. This right here is the magic scaffold for healing. Finally, your bite is adjusted just a bit so those healing teeth aren't overworked. You go home, you eat soft foods for a day or two, and that's the whole shebang. All right, let's talk numbers. Section 4, the true cost of treatment. Dental billing is pretty much always confusing, right? But it really just comes down to a contrast in timelines here. Perpetual maintenance versus a definitive one-time treatment. A lifetime of quarterly maintenance visits, that adds up fast. We're usually talking $800 to $1,600 a year, every single year, indefinitely. And the scary part is, all while you're paying that, bone loss might still be quietly continuing in the background. When you look at the 10-year math, paying a higher upfront cost for a definitive treatment that actually stabilizes the gums is often financially smarter, and biologically, a whole lot better. And to put that into perspective, here is a staggering number you have to factor in: $3,000 to $6,000. That is the typical cost to replace just one lost tooth with a dental implant. When you look at it that way, it really drives home the massive financial and biological value of saving your natural teeth while you still can. Which brings us to our final step, Section 5, taking control of your care. You know, high-stakes medical decisions require asking the right questions and really advocating for yourself. As the guide states clearly, a second opinion is normal and expected. I want to completely reassure you here. If a treatment plan totals more than $2,000, seeking another perspective is 100% reasonable. It should never, ever insult a good provider. Actually, any dentist who reacts negatively to you getting a second opinion, well, they're telling you something very important about how they practice. Now, this is the perfect checklist. You might literally want to take a screenshot of this slide and bring it to your next consultation. Get precise, specific answers about your own mouth. Ask them, how many 5mm pockets do I actually have? Where exactly am I losing bone? Are any of my teeth at real risk of being lost in the next year or two? Don't accept vague answers here. Pin them down.